At night, it's Wild Wild West.
Can law and order be brought to a notorious San Francisco city street?
And then when I came to San Francisco and drugs were very rampant.
Today, we're talking about a plan to stop crime under the cover of darkness with mass arrests.
The Tenderloin don't even start till 10 o'clock at night.
This is CBS News Bay Area with Elizabeth Cook.
And I'm Ann Makovec. We've all seen the scenes of people looking like zombies on the streets of San Francisco. Open drug use, often leading to petty crime, and a general sense of lawlessness, especially in the Tenderloin. Today, we have a look at some of the changing crime rates and the bold new plan by one city leader hoping to disrupt the status quo. He's going to be joining us live in just a few minutes. In San Francisco, city leaders say that crime is down to a more than 20-year low. That includes drops in property crimes like car break-ins, as well as a 60-year low in reported homicides in the city. In 2024, they say crime overall hit its lowest point since 2001. San Francisco Supervisor Matt Dorsey is looking to maximize enforcement against illegal drug use, meantime, in the city's 6th Street corridor. That is at the intersection of South of Market and Tenderloin neighborhoods. Dorsey says the public health epidemic caused by the rise in fentanyl and meth use is one of the worst in San Francisco history. He says a crackdown against drug-related crimes at the 6th Street corridor could lead to as many as 100 arrests per night. Incoming Mayor Daniel Lurie says this is an issue that has gone on far too long.
It's something that we have to get control over. It's why I'm so committed to getting our behavioral health crisis under control starting on day one of my administration.
Lurie says cracking down on illegal drug use at 6th and Market will be a priority of his administration. Meanwhile, California's Justice Department found that SFPD was in substantial compliance with its 8-year-long reform plan. SF Police implemented more than 250 policy recommendations that the State Department of Justice oversaw. The police department says the successful reform strategy has significantly lowered crime rates in the city. Well, joining me now to talk about it all is Supervisor Matt Dorsey. Thanks for being with us today.
Thank you, Ann. I appreciate the opportunity to be on.
Tell us about your plan. It is pretty bold, and you're really wanting police to focus in on that corridor, people openly doing drugs on the streets on 6th Street.
Well, drug-driven lawlessness in my district and elsewhere in San Francisco is at levels that we've really never seen before. So that's why I'm asking for the relevant departments, which are the police department, the sheriff's department, the Department of Public Health, and also the EMT division of the fire department, to report back to the Board of Supervisors on what resources they need to bring a solution as big as the problem. Now, right now on the 6th Street corridor, according to the police captain there's at least 200 people per night engaged in illegal drug use. What I'm asking is, what would it take for us to be making criminal justice interventions, arresting people, but more than that, making sure that we're getting them into compulsory detox or treatment programs. With the last election, we have, with the passage of Prop 36, treatment mandated felonies that really put drug courts back in the game. But to make use of those, we need drug treatment. So it needs to be law enforcement and public health working together, but we need to bring solutions as big as the problem.
Okay, and I guess that's where this number of 100 is coming from, because that's kind of an eye-boggling number when it comes to people being arrested for simple drug use.
Well, what I would say is to ask the people who live in and around the 6th Street corridor, when they see the scale of lawlessness that's playing out there. The burgeoning crisis in drug-driven lawlessness is something that's not helping anyone, not neighborhoods, not small businesses, not our economy, but least of all, not anyone who is on the street addicted to drugs. The reason I asked for a role on the San Francisco Board of Supervisors is because of my own journey in recovery from drug addiction. So I do understand that this is a really difficult thing to be captured by. We do need people to be making interventions in this that can be life-saving. I'm not interested in doing something that's only punitive if we don't have medically assisted treatment and the kind of detox and medication-assisted options available.
Okay, but it would at first be punitive. You're talking about taking these people to jail if there are no treatment beds available?
No, the idea would be, what I'm asking city departments to report to the Board of Supervisors is what would it take for 100 arrests that we then see through detox and treatment if all we're doing is putting people in jail and we're denying them access to medication that could help them with withdrawal and cravings and a lot of the things. The good news is many of these drug addictions, especially opioid use disorders, have medications that can treat them. Most of the folks out there are not too far gone, but we are not doing anything for the people who are struggling with addiction by simply enabling it and throwing up our hands and saying, well, it's just drug use. The reality is this is diminishing the neighborhood. It is robbing neighbors and residents of the safe enjoyment of their communities. And it's at a scale that we've never seen before. It's a priority for me. I'm encouraged that it is a priority for Mayor-elect Lurie. I think we're going to be strong allies in this. But what I am hearing from the people I represent in District 6, the South Market area, is they want solutions. They are done seeing this problem pushed from one block to another, and then we call that success. It's not success. We need to get people into recovery, and if we need mandated treatment through the criminal justice system to do it, let's do it. We got lives to save.
Okay, how realistic is it, though, when you're talking about rounding up to 100 people? If there aren't treatment beds available, would they go to jail or they would not be rounded up?
Ideally, what we would have is a detox, a detox facility that we could make use of. And that's part of what the inquiry that I'm asking to get back is going to tell us. I'm not interested in sending people to jail if there's not medical or clinical interventions there. But I will say this in San Francisco, we're very lucky, and I think you just covered this a few minutes ago. San Francisco really doesn't have a violent crime problem. What we do have is an extraordinarily serious street-level drug use problem. And if we can solve that, we're going to see change in our economy, in tourism, in commuters. Right now, the public safety challenge we're facing is solvable. And the good news is, even beyond that, is the more we can do to solve this, the more lives we can save of people like me who struggle with drug addiction.
I would agree on all of that. What do you think with the new mayor coming into office tomorrow? What is that going to mean as far as changes on the streets?
You know, I have been very encouraged in my conversations with Daniel Lurie going back a couple of years. His priorities are my priorities. He understood that I didn't support him for mayor, but I said to everybody that I was going to be committed to my city. We're all on the same page tomorrow when the new mayor takes office and some of my new board colleagues are sworn in. I think it's going to be a new day in San Francisco, but San Franciscans are ready for some change. And I think it's time for us to start delivering it and to bring solutions as big as the problem. And we'll see how that goes, but I'm looking forward to working with Mayor Lurie.
All right, Supervisor Matt Dorsey, we appreciate your time this afternoon.
Thanks so much.
Coming up, we're going to ask a recovery advocate in San Francisco what he thinks is going to make a difference on the streets of the Tenderloin. We'll be right back. Welcome back to our conversation on crime in San Francisco. Before the break, we told you about a proposal from Supervisor Dorsey to arrest 100 people a night on 6th Street. Those people going into treatment beds, hopefully, instead of jail, but there really isn't the infrastructure right now to complete all that. This is the latest effort to crack down on illegal night markets and activity overnight in the Tenderloin. And about 6 months ago, the Board of Supervisors restricted what businesses could sell late at night. Well, some local businesses support the curfew, others aren't convinced.
If it makes a difference with keeping the city safer, I'm with it.
Well, they're just trying to blame businesses for, for being open all night. But I don't think that's the issue. So homelessness has been going on for San Francisco for like more than 10, 15 years.
Well, the mayor's office says the goal is to improve the well-being of those living in the Tenderloin. Joining me now is recovery advocate Tom Wolf. We've spoken several times over the months. Thanks for joining us today.
Thank you.
Now, we know you've been through the throes of addiction yourself. I just want to touch base on some of these plans, say the curfew in the Tenderloin, curtailing what businesses can sell late at night. Do you think that would make a difference?
Well, it might make a difference. So look, after midnight, the residents of the Tenderloin are already up in their apartments, et cetera. They're not coming out. The people that are out there going to those stores are people experiencing homelessness and a lot of organized drug dealers. If you look at some of the items that are being sold in many of those stores, you've got basically what tantamounts to drug paraphernalia in many cases, butane to fuel their torches, to smoke their meth, lighters, snacks, et cetera, all that stuff that's out there. So they're servicing a clientele that's experiencing homelessness, and by closing down those stores overnight, it's discouraging groups of people from congregating in large numbers on certain city blocks. So I can understand the logic.
What are your thoughts on this plan for 6th Street that we just talked about with Supervisor Dorsey?
Well, I support this plan. So I'm a big believer in accountability. I got clean and sober because I was held accountable for the crimes that I was committing on the street. And I firmly believe that accountability is one of the cornerstones of recovery. And while, people lament about a lack of treatment in San Francisco, and there is, today in San Francisco, according to the Department of Public Health's own website, they have 52 treatment beds open, including 21 detox beds that are already bought and paid for, going unused today. You add on to that all of the private organizations like the Salvation Army and Delancey Street that have beds that they pay for on their own that are sitting empty right now. We could actually fill those beds and make a real impact on the street while getting people on the road to recovery.
Okay, so the goal would just be to compel people to use those resources. Is there any other way you can think of to do that besides arresting them?
Well, so look, you'll hear a lot of critics of this plan say, well, people have to be ready and they have to willingly go to treatment. But if you're addicted to fentanyl and you're living in a tent and you have to use your fentanyl every 2 hours to avoid going into withdrawal from the drug, you're not, that day is never going to come. So you need a nudge, you need a push. And oftentimes that push has to be through law enforcement. And now again, with Prop 36, as Supervisor Dorsey had previously mentioned, being in place, there is the law in place now to help compel people to treatment. If that means they have to go to jail for a minute and then go before a judge in drug court to actually find their way to treatment, then that's the way it has to be. But you have to understand that, look, it's about the behaviors that are being exhibited on the street. It's not just people, it's not someone just smoking a joint of marijuana on the street. You have people using fentanyl and meth on the street that are shoplifting from local small businesses to support and maintain their addictions, creating a chaotic situation that has literally brought San Francisco to its knees and has drawn international scrutiny on our city, which is why I'm so hopeful for the new mayor that's taking over tomorrow, Daniel Lurie, to turn things around.
Okay, you're hopeful. Do you think it's going to happen?
It's a marathon. We have to understand that you can't wave a magic wand and make things change overnight. Homelessness and drugs have been a problem in the city for quite some time, but ever since fentanyl arrived here in 2018, it's become exponentially worse, including our city being infiltrated by organized drug dealing, which nobody seems to talk about these days. We still have an organized drug dealing ring operating in plain sight in San Francisco right now, selling kilos upon kilos of fentanyl on the backs of 8,000 people that are struggling with homelessness, plus a few thousand more that are already housed. And it's just not fair, and it's not fair to the city and county of San Francisco.
Yeah, well, I know the locals have been working with the feds trying to put a stop to that, but as you said, it is a marathon. Really appreciate your perspective on that, recovery advocate Thomas Wolf. We'll be right back.
Thank you.
Well, San Francisco is getting a new mayor. Daniel Lurie is going to be sworn in tomorrow. We will be there. You can watch our live coverage starting at 11 o'clock right here on KPIX and streaming on the free CBS News app. Thanks for watching. You can always get all the latest headlines and weather over on PIX Plus. And remember to like and click the button on the bottom left of your screen to subscribe for the biggest Bay Area news.